Welcome to the Healing Center Conversations podcast, where we create space for conversations that heal. I'm your host, Dr. Byron McClure, a nationally certified school psychologist. I, along with our special guests, will give you insight to promote collective healing by putting people first. Through weekly conversations with educators, psychologists, and healers, we'll discuss ways to heal, thrive, and live your best life. This is the Healing Center Conversations podcast. Welcome to the Healing Center Conversations podcast, where we create space for conversations that heal. I'm your host, Dr. Byron McClure, and we have a very special guest, my god sister, longtime family friend, none other than Dr. Keiva Bland. I'm going to quickly go over her bio so that you all know the amazing Dr. Bland that's before you today. Dr. Keiva Bland is a board-certified and fellowship-trained surgeon from Detroit, Michigan. What up, though? Who practices general surgery with an emphasis on breast diseases. She attended, should we say the Howard University or the other
Yes.
HU? Which one should we say, right?
Howard
Out to Hampton. She attended Howard University in Washington, D.C. for both undergrad and medical school. She graduated from the College of Medicine in 2000 and went on to do her general surgery residency at Wayne State University in Detroit. Upon completion of her residency in 2006, she completed a fellowship in breast surgical oncology at the University of Arkansas for Medical Sciences in Little Rock. She returned to Detroit to Wayne State University in 2008 as faculty and is practicing in the Detroit Medical Center and Carmenos Cancer Institute. She has book chapters, scholarly articles, and invited lectures to her credit. She is involved in outreach, speaking locally for community programs, mentoring, and mission work in the Dominican Republic. She is a member of the Psi Delta Omega chapter of Windsor, Ontario, Canada. Dr. Keiva Bland, welcome to the Healing Center Conversations podcast. Good to have you.
Thank you. I'm happy to be here. Thanks for thinking of me.
Like, hearing that bio and all of those things, how does that feel hearing that?
It feels pretty good. It feels pretty good. Yeah, it feels pretty
Right.
good. I've done a few things.
You've done a few things. So for the listeners who might be new to you or haven't heard of Keiva, who is Keiva?
Keiva is a sister, a friend, a daughter, and god sister, but Christian lady who lives in Detroit, well, in the Detroit area, and is just working to serve her community that she grew up in as a surgeon, and particularly a breast surgeon. And so that's who I am, and that's what I do.
Very cool. And just a little more context to that, I have known Keiva since I had to be what? Like 6 years old.
Yeah, 5 or 6 years old. Yeah.
Yeah. So if we went with 5 years old, I'm 35 years old now. That means we've known each other for 30 years.
Yep. Yep.
How does that feel? Knowing that we've known each other for 30 years, since I've been a little snot-nosed kid running around.
See, for me, it's very weird because you're a grown man with a family and, you have your doctorate and you're just doing big things. And so for me, to know that all this time has passed and you've accomplished so much, it makes my heart swell a bit. But yeah, it is a little bit weird for all of that. I mean, good grief. That's a long time.
That's a very long time. I'm just sitting here thinking about that. And so we met in the DC area, attended church together, and you were an undergrad student at Howard University at the time. Shout out to Howard University. So I'm interested to know, after undergrad, you went there for medical school. What was that experience attending the medical school at Howard, and why was it important for you to attend a HBCU for medical school?
So two things about it. One, let me start with the HBCU part of it first. So I applied to majority institutions also, but I fortunately got Howard because I didn't want to leave the DC area. That was the first thing. I didn't feel like my time there was done yet. But I also applied to Meharry as well because I thought that the history of both of these schools were amazing. And then I applied to Wayne State back at home, among other schools. So those were the schools that I got accepted to in reverse order of the way that I wanted to be accepted. So I got accepted to Wayne State first, then Meharry, and then Howard. And so for me to continue at Howard, it was important because the legacy of Howard University and tradition is incredible. And when you walk the halls and see all the people that graduated before you, and then you hear the history of it told to you by someone like Dr. LaFaw, God rest his soul, who was present when Dr. Charles Drew was at Howard University. Like, he was one of his instructors. And so he did a great job of carrying on the legacy of Dr. Charles Drew and those type of things. And Dr. LaFaw in of himself was a living legend. It was amazing. And that it's still that same thing of you have to work twice as hard as those around you. And they kind of still instilled that into you, but by seeing the history and the legacy, you know that you can do it. And so I think at a time where you still need a lot of support, it was good to have that support at Howard University and for people to, to believe in you, but to not allow you to have excuses because they know it's been done with less.
Yeah.
And so I think that was an important thing. Mm-hmm.
Awesome. How many, do you know off the top of your head, how many other HBCUs actually have medical programs?
So I'm going to have to tick them off for you because I can't count. In my head, I just can't count them. So there's Howard, Morehouse, Meharry, Charles Drew. I'm not sure what the status of Charles Drew is. So that was 4. I think that was it. Like Meharry is associated with Fisk. It's like right across the street from it. Yeah, I can't think of any more.
So it's a handful. It's a handful
Yeah.
of medical programs at HBCUs. And what's interesting, it's the same way in the field of school psychology. There's 2 that are accredited now. Howard is one of them.
Okay.
And then
Okay.
Bowie State. There were a handful of others. FAMU had one.
Okay.
TSU had one. But those
Okay.
programs have either shut down or have lost accreditation. So there just aren't that many. Which is why it's interesting and important to me that HBCUs have higher ed programs for all of those things that you mentioned, especially for medical students. And so you went to medical school at Howard, and what did you want to focus on while you were there at medical school?
Oh my. So I always tell this story. It was really kind of weird. So when I entered, I have to say that I failed out my first year.
Really?
Yeah. So I went in wanting to do orthopedic surgery because my undergrad major was athletic training. And so 2 things with orthopedic surgery. 1, I realized I didn't even like the field. But 2, I felt like I wouldn't be able to get it anyway because of failing out. Because for orthopedics, you have to be, top of your class. But the main thing was that I didn't like it, and my mentor was orthopedic surgeon, and so it's kind of hard to be like, I really don't like what you do, but but then when I got back in, and I think everything happens for a reason. The providence of God is very, very strong, and I see it in my life all the time. And so it was one of those things that it was meant for me to be a little bit later, because after I went through my clinical stuff, so our first 2 years we're in our preclinical phase, just more in the classroom, and then your last 2 years are your clinical years. And so when I started my clinical years, which we call clerkships, I liked every rotation I did. And I thought I was going to do pediatrics. I mean, I was a Sunday school teacher for kids. I was always babysitting everybody's kids and stuff like that. I was good with kids. I thought that I should do pediatrics. So that's what I was pretty much set on. And then I got brainwashed into surgery. And it was the best brainwashing ever, because here I am years later and I wouldn't do anything different. So it
That's
worked
really
for
cool.
me. Yeah.
And look, me and my brothers, we were part of those kids that you babysit.
Exactly.
We'll testify. You did a great job.
Thank you. Thank you.
Look, what's funny is you were one of the few who actually stuck around, right? And
Yeah.
lasted as a babysitter. What's was what's really cool with that is that you were able to finally land on something that you wanted to do. I could totally see you as a pediatrician, but you landed on oncology, being a breast surgeon. And so what was it about that particular space, being a breast surgeon, that intrigued you, or you were like, this is it for me?
Yeah, so when I was in residency, it's a 5-year residency, and during my second year is when we would have our breast rotation. And what I saw when I went to my breast rotation was that I feel like women would come in very scared about their diagnosis, thinking they had a death sentence, those type of things. And then we had a few breast surgeons, and the 2 that I felt gave the best conversations to the women let the women leave feeling empowered as to, okay, these are my choices. I will get back to you with what I want to do, versus, feeling like the cancer had all the control and they had none. And then there was another person who would give the explanation to the patients. And I could see the patients like just getting more confused, more scared as the conversation went on. It kind of started with, in the 1800s, there was Dr. William Halsted, who did a mastectomy on the table, on a kitchen table. It's just like, that's not how you start this
That's
conversation.
how the doctors would start the conversation?
That was this one particular doctor, and it was a woman. It surprised me because it didn't, provide the patient with any comfort, even though she was trying to tell them that things had improved in the way that we manage breast cancer, stuff like that. But it didn't give them any comfort. So what I saw was that this was a field where you can empower women. One, two, you could, give people hope, and three, there were more wins than there's losses. More women survive breast cancer than lose their battle with it. And so I think I wanted to be a part of that. And, on a personal level, I felt that it would probably fit a lifestyle, if I was to have, husband and kids in the future, just because I felt it was a little bit more of a controlled situation. So there were multiple reasons, but that was mainly the reason why I went to breast cancer, was to get some good outcomes and empower people.
That's really cool to hear. And especially since we've known each other, like
Uh-huh.
hearing that's the reason why you went into it is
Mm-hmm.
really insightful for me, and it's fitting as well. And so, in thinking about my role as a school psychologist in my
Mm-hmm.
field, I see some overlap, not a
Mm-hmm.
lot, but in terms of demographics, right? And in some of
Mm-hmm.
my research, prepping for this episode, I found the statistics of black doctors in the medical field. In school
Mm-hmm.
psychology, there's approximately, depending on estimates, anywhere from 2 to 4% of
Mm-hmm.
black school psychologists. Then when you look at black males, it's even lower. When I
Mm-hmm.
looked up medical doctors, according to the Association of American Medical Colleges, there's only 5% of active medical doctors who identify as black or African American. And then, according to Zippia.com, only 2.4% of surgeons identify as African American. So, Keiva, I'm interested to hear from your experience. What has it been like as a black female surgeon in this space?
So I feel that for me, it has not been as challenging as I would think that it was going to be from the outside looking in. I think part of it is where I'm located, because being in Detroit, with we're heavily populated with African Americans and people of other minority groups. We are well supported in our field here, which is good. And so when I did my residency, yes, I was only the second African American woman to complete my residency, and that was in 2006. The first one was in 2005.
Wow.
Yeah, exactly. And so we were a little bit of a rarity, when I started my residency. And so I felt like I was supported in just about all aspects, including from my faculty for the most part. There were still a few who I don't think that they were as supportive maybe as I thought they could have been, but neither here nor there. And so I felt very fortunate in the way that things happened for me. So I didn't really feel the sting as much, I think, if I had been at a different institution. I'm just going to say that. And I was fortunate to have a mentor here who was also a Howard grad. Like, he did everything at Howard, and then he was here in Detroit. And so, to have him in my corner helped a lot when I felt like things got a little bit rough. But I don't think that it had much to do with my race, and I'm grateful for that. Really
That's
grateful.
great.
Yeah, because some people did not have it as well in other places. And so I feel very grateful for my experience. And then I would say, like I said, in Detroit here, the people of Detroit are actually pretty fortunate in that they do have quite a few options for people of color that they feel they can identify with. And some people specifically do want that. But I will say I'm trying to figure this out, but I think at this point that I am the only African American woman board certified, I mean, not board certified, but a fellowship trained breast surgeon in Detroit. So at this point, I'm feeling like a little bit of a unicorn,
Mm-hmm.
even though there are a lot of other, good women and breast surgeons here, different races and stuff like that. But for African American, I think that I'm it for Detroit right now, African American woman.
Yeah. And is
Yeah.
there a push to increase the amount of black surgeons that you're aware of?
So the main increase is to try to increase the number of Black medical students. So at Wayne State, they have an initiative to try to increase the amount of African American med students because, it is, I don't know what the percentage is, but it's kind of shameful for it to be medical school in the city of Detroit that has such a low percentage of African American students. Like I would say less than 20%, when that's not nearly the composition of the city and surrounding areas. And so there's a push for that, absolutely.
Yeah, and we see the same thing in the field of psychology,
Mm-hmm.
and even more niche down in my field of school psychology as well.
Mm-hmm.
There's this
Mm-hmm.
big push to increase the amount of us in this space. And we
Yeah,
see that when there are more Black psychologists in the space, then the outcomes for students improve, which is, it matters. And
it
so
does.
in my work, I look at how can we heal, right?
Mm-hmm.
And I adopt healing centered practices. That's
Mm-hmm.
the belief that I have. And what you do, it's real healing. What I do is real healing too, but
Mm-hmm.
I look at your healing and treating, physical manifestations of illness.
Mm-hmm.
So, Dr. Bland, I would love to hear, what does healing mean to you?
Healing means to me a process, just like, that ing means it's in process. And part of that means that, of course, doing the things that we know we need to do and also kind of adapting to what works well for you. In my particular field of breast cancer treatment, and this is not always a popular opinion, but I really try to discourage alternative medicines. And the reason for that is that they've not been proven to work, at least for, I would say, more advanced cases of breast cancer and those that we solidly know are breast cancer. And so healing, yes, it takes a lot of different forms, but from a medical perspective, some of it goes along with go with what we know works. And respect the expertise that's trying to give you that information. And so healing in the medical sense means let's work with what is proven, and then you can use all the other stuff to support you, and that's alternative medicines, that's spiritual and emotional avenues that you have to take to get to that point to even be able to accept the treatment, because sometimes that's where we have to start. It's like getting you to even accept your diagnosis, accept the treatment, accept the recommendations. Sometimes it takes a lot of, prayer, meditation, yoga, support from your friends, support from people you don't know, those type of things. But I think that healing to me is always a journey. It just seems like that ing part of it means that it's not done. It's, like a process that's kind of ongoing. So I think that's what that means to me, aside from, of course, the physical, like cure. But that's what it means.
Yeah, and I think I generally agree with you as well. I'm
Hmm.
interested to hear from your perspective, especially as you mentioned that mental and emotional toll. I would like
Hmm.
for you to discuss the impact of stress and mental illness on physical sickness. Because I'm sure you see that a lot. Do you see any overlap there, or what's your take on that?
Yeah, so well, speaking from cancer perspective, the stress itself doesn't necessarily cause the cancer, and that's what I think is important for people to know when dealing with cancer. A lot of people feel like they have the control to actually create cancer, but you don't have that control to actually create cancer. We can all reduce our risk, but by doing things like keeping the stress under control. But I always like to remind people you don't have that power, because if you have the power to create it, you have the power to cure it and get rid of it. And we don't always have a cure for it, or we can't get rid of it. And I think that you have to be able to accept both sides of it, if you understand what I'm saying. Like if you have that kind of, I don't know, almost like a God complex about it, that yeah, I created this, or my bad behavior created this, or this caused this or the other. But as far as the stress part of it goes, it does cause inflammatory markers in our body to be released. And inflammation, we know, is a horrible thing for the body. It causes everything to go awry, including the function of our cells that we need to actually do the surveillance in our bodies to be able to catch tumor cells and prevent them, try to prevent them from being able to establish themselves and grow. It prevents the other normalizing, like hormones, or they call them cytokines, but hormones like that our bodies release. It keeps them from being able to have their effects. It causes us to store fat. It causes our blood sugars to go up, which increases inflammation, causes hardening of the arteries, those type of things. So stress can cause like an overall problem with the body and the body to be able to sustain itself and cause it to dysfunction. And so that's the role I think that stress plays, in that it doesn't prevent our bodies from doing what it has to do, but it definitely slows the process. But it doesn't cause the cancers. It just keeps us from being able to do the best that we can from our bodies to be able to fight them. But as far as mental illness goes, mental illness, the problem that I see with this, and I see it quite a bit actually in my practice, is that it prevents people from being able to make the appropriate decisions that they need to take care of themselves. And that part is heartbreaking. And the problem is that, sometimes you want to just go above and beyond and essentially like take the power away from them, because it's like, I don't want you to die. I don't want, this horrible thing to happen to you. But even with mental illness, people still have agency and are able to make their own decisions. It just might not be the best decision. And that's what I would say, like the extreme forms. Even with something that's not as extreme as like the psychosis and those type of things, I would say that depression and just that feeling of feeling blue keeps you from making good decisions for yourself as well. And so getting into mental health services early is very important for a lot of people facing cancer.
For sure. One of the things that you mentioned when we first started our conversation
Mm-hmm.
is what attracted you to the field of oncology. And one of those things were the conversations that the doctors were having with the
Mm-hmm.
patients.
Mm-hmm.
I'm wondering if, in your experience and in your practice, the conversations that you have with those patients who might have received a diagnosis with cancer, if they have family, friends, especially a lot of our listeners are educators, psychologists working with families.
Mm-hmm.
What are some things that you might say to those families or parents of how to support kids who might have a loved one who might be struggling with a cancer diagnosis?
hmm So I would not necessarily have a full answer for that, except to recommend that they, get in touch with psychological help for the kids. And that could start with the school counselors and, the school help and those type of things. But going back to the way that the kids even need to be told, or even just family in general needs to be told about what's going on with the person, you have to have a full story before you can start talking to your family. So you need more information so that you can give them like truthful answers, of course age appropriate, but truthful answers about what's going on. So a lot of times people want to tell people like as soon as they get an abnormal mammogram, or a biopsy done, but you don't know the answers to that, I think I have cancer. Or something like that. And that's not helpful, because now everybody's kind of wigging out and you haven't given them enough information for them to know how to be able to support you. You know what I'm saying? And a lot of times it ends up being not anything that's like super huge, but now everybody's like all wigged out and they're frantic. And so I find that the best way to talk to families is once you have information. What is this? What's the stage of this? How do we treat this? What's the prognosis for this? And then give that information in age appropriate ways. With kids, the most important thing you can do is just keep encouraging them, like when they know, because they're going to be scared, but they have to know that there's treatments for things, and that this is just going to be a rough period for a little while, and then when this is over, that you'll feel a lot better. That's, to me, that's always been the way that I think is the best way to do it. For those who have terminal illnesses, the psychological help will definitely be more important, in talking with their kids and trying to prepare their kids, for what's to come in a way that's not scary to them. But I have no answers for that. That would definitely be something for, a psychologist, a mental health professional, because I don't have those answers.
Yeah, no, the information that you shared I think is really helpful. Making sure that families, loved ones have facts and as much information as possible. I think that's excellent advice. So,
Mm-hmm.
Keiva, one of the things that you mentioned earlier is that you got into this space to empower women because
Mm-hmm.
you can have more wins than losses. And then
Mm-hmm.
you talked about hope. So, I
Mm-hmm.
would love for you to share a story and experience to where you really feel that this case embodied hope and there was a win, a success story there too.
That's
I know
actually
we're
a
going
good
on script
question.
too,
I
so
know. I'm like, that's a really, really good question. I wish that I could tell you like one very specific one, because I actually have, it's almost like a conglomerate of them. And I'm just trying to think about it. But okay, actually I could tell you one. So I have a patient who actually is the friend of some family friends who I ended up taking care of. And she has a little girl, actually. And so she came in. Fortunately, she was a very faith filled very faith-filled. And so she came in with this diagnosis. She was terrified, actually terrified of it, even despite her faith, which is, understandable. But once we explained to her that, this is treatable, is going to require everything that we have available for breast cancer treatment, but this is treatable. And we actually had to have this conversation with her daughter in the room. Her daughter was about 3 years old. So, yeah. So, just kind of like talking, what are you talking about type of things. But, we just kind of described as mommy has a boo-boo and it's going to require some medicines. And, we got to get rid of, this little boo-boo for her. She's actually been doing well. She's about 3 years out now. And she is doing quite well, and I'm really happy for her. She's doing really well. The other one is a patient that came to me, and when I started talking about this other one, it made me think of this one other. When I tell you that she was frantic, she had a mass on her breast. She was frantic, and she had a really good support system in her husband, who was just holding her hand through everything. And so when she came into the office, she didn't even have any like mammograms or anything like that. So I had to do the biopsy in the office, just to kind of get her started, because like she was freaking out. She couldn't wait for things to be done the other way. And every time I gave her some more information, it felt like another shoe was dropping and another shoe. And it was like, how many more shoes do you have? But the more information that we got, the more that we had to tell her, okay, this is what we have to do this for this is what we have to do for this. So I'm really happy to report that now that she's on the other side of it, she was saying that in hindsight, she was surprised that she was so scared, because she feels like she's doing so well now. Like, she finished all of her treatment. She's about 3 months out from all the completion of all of her treatment. And she's just surprised now. It's just like, I told you that you would, but this is something that, we all go through. So the phrase that I always use for people is that I don't give people false hope, but I try to make them hope for what is possible. And so that's what I always tell people, because sometimes like things are not going to turn out the way that it's going to be, but I don't try to give people like a fake impression of what's going to happen. Just based on what we have, this is what usually happens. And so let's just hope that this is what happens. You know what I'm saying? But sometimes things can go left, because that's just the way cancer is. It's nasty, and it's not, a really nice thing to deal with. So both of those were really good, like feel good stories for me.
Yeah. And I love that you are giving people hope for what's possible. Mm-hmm. So Keiva, what do you do as a surgeon for fun? Like in your off time and your downtime?
Travel.
Yeah.
I love to travel.
Top 2 places that you love to travel to.
Ooh, so it's evolving, but Hawaii is definitely my favorite. Hawaii is definitely a favorite. And then Dominican Republic, of course, is a favorite. So Hawaii, just because, when you get off the airplane there, it smells different. Like, it's different. And I love that it's a, part of the United States, no matter how it got there, because, again, that's controversial. But it's like being in a foreign country, because they have their own culture, own foods. It's amazing. I love Hawaii. And then the Dominican Republic, I would always go there for vacation with my friends. But then as a result of, our brother Marcus, I started going there for mission trips, and I feel a kinship with the people there that I felt even before I started the mission trips. But the mission trips definitely, has really endeared me to the Dominican Republic. I just love it, the food, the culture, everything. So
very cool.
Yeah.
I know you have to have something coming up. Do you have any travel plans coming up soon?
Unfortunately, COVID has put a damper on all travel plans. However, I think me and my girlfriends are going to try to do our usual winter trip. We normally would go someplace in January, February. So we're planning for February, hopefully to go someplace, but we don't know just yet where we're going to go. But we've been doing this since, I want to say like 2003, 2004, something like that. Every year we go someplace. And so it's only recently been dampened, because of that. But we were pretty good with our streak for a while. So yeah, so I just don't know. Someplace tropical, though.
I love it.
Yeah.
As we bring this episode to a close, any closing thoughts that you have?
I would just, this is very important, your healing-centered kind of conversations. I do appreciate that this is what you're doing, because I think we all need to find ways to tap into ways to kind of, feel better in life and have reasonable ways to kind of get there. We were talking off camera before about, getting rid of the toxicity in our lives, like in terms of people and the ways that they deal with us. I'm not saying discard the people, but I do like that there's ways for us to kind of identify things that are kind of bringing us down, and that we need to figure out how to better deal with those things to kind of keep us afloat. Understand that we are going to have our ebbs, but hopefully, we go more with the flows. But this is very helpful.
Absolutely. I did have one more question for you.
Yes.
That I'm really intrigued. And you can say past if you want,
No
but
problem.
we met, through church, faith,
Mm-hmm.
religion, and all of
Mm-hmm.
that, and
Mm-hmm.
just through life, through experiences, but especially in your practice as a surgeon, has your
Mm-hmm.
perception of spirituality changed or evolved at all?
It's been strengthened as a result as a result of, again, like that helplessness of we don't have the power to create or to get rid of on our own. And the reason why I say that is that, dealing with cancer, for instance, everybody wants to be able to explain where their cancer came from. And unfortunately, I always have to just tell them, you know what, it's just something that happens. And the reason why I say it like that is because if you have the power to create it, like I said before, you have the power to get rid of it. And we don't have the power always to cure nor to start it. And so when people try to understand where it happens, I say, listen, there are people who run marathons who die of heart attacks, right? And then there's the person who lives to be 100 years old, who smokes all the time and never have lung cancer, at least one, or at least one that doesn't kill them. And yet somebody dies of lung cancer who never smoked a cigarette in their life. And that weirdness, is something that just can't be explained except to say that there's something bigger than us. And then there's other times when I'm like, it seems like the person has everything that happens to them that it really truly should take them out, and yet they're still here, and a person dies of hardly anything. And I'm like, that's we don't have that power. So we have to pray, do things that we know how to do, and to go from there. But the one thing that I always marvel at, and this started in medical school and even before that, but in medical school we had to do like our cadaver labs and stuff like that. When you're learning how the body is made and how the systems in the body work, I always just say, to me, that is not something that could be random or comes out of chaos, if you understand what I'm saying. And so the more and more that we deal with people and you just don't understand why certain things happen, for me, because I believe in God, it has to be God. It just has to be. And so for me, I feel like my faith has strengthened, as a result of what I do, because the body is just so wonderfully and miraculously made. There's no way that that could be a random thing. So it strengthens with me. So
That's really fascinating. Dr. Bland, this has been such an honor to have this conversation with you. Where can people find you on social media?
I don't have a lot of medical related information on there, but they can find me on Instagram, Facebook, and I'm on TikTok, but I don't have anything on there. So, but on Instagram, I go under Kayell Bland, Bland, and then on Facebook, I'm under my own name. So.
All right, listeners, make sure you go give Dr. Keiva Bland a follow on social media and let's blow her TikTok up. I think you can do really well on TikTok. TikTok is growing, so you could just, you know, post
Yeah.
different things a day in the life. That would be really cool. Thank you for this Healing
Thank
Centered
you.
Conversation. Listeners, thank you for tuning in to the Healing Centered Conversations podcast. Be sure to follow the Healing Convo Pod across all social media platforms. Help us grow by liking, sharing, commenting, and leaving a positive review. Tell a friend to tell a friend about the Healing Centered Conversations podcast. Until next time.